Hi everyone, a blessed day to all. So I'm always praying for God's protection and guidance be upon us as we continue with our discussion. Okay, so this presentation is a continuation of our topic for this week. So this is the second topic for this week about physical examination on the head and neck. Okay, so before we proceed to our topic in this presentation, let me present to you this slide. Okay. Okay, so in this presentation, we will discuss the physical examination of the head and the neck. Of course, we will do this after the general survey, the vital signs taking, the assessment, and then the physical examination of the skin, and then it will be followed by physical examination of the head and the neck. Okay. Okay, so these are the learning objectives of this presentation. At the end of this presentation, the student will be able to identify the basic structures and the function of the head and neck and the purpose of each, and will be able to collect an accurate health history of the head and the neck. Okay, we'll be able to perform physical examination techniques to evaluate the head and the neck, and then to document the physical examination results. Okay, so before we proceed to physical examination, it is important to review the anatomy and physiology of the head and the neck. Okay, so the head is the upper portion of the body that contains the following structures: the cranium, okay, wherein your brain is located; the face, which houses the sensory organs such as your eyes, your nose, your mouth, and your ears laterally. No? Baka sabihin nyo yung ears, sabi ni Ma'am Dayrit, nasa face. Of course, at the lateral side of your face. Okay. And the neck, okay, where you can find your throat, the thyroid gland, and the lymph nodes. Okay. Okay, to continue with the anatomy and physiology of the head. Okay, the head has four main regions, or divided into four main regions that take their names from the underlying bones of the skull: the frontal, the parietal, temporal, and occipital. So knowing these regions of the head helps us, the examiner, to locate and describe our findings. Okay, so this image is the lateral view of the head, where you can find the four main regions of the head: the frontal region or frontal bone, the parietal bone, where you can find the parietal region, the occipital bone or the occipital region at the back of the head. Okay, at the sides of the head, just above the ears, we have the temporal bone or the temporal region. So moving on to the health history of the head, or the subjective data about the head. you have to note the following concerning or common symptoms, such as the head injury, head or neck surgery, or the traumatic brain injury. So we will discuss this further in the next slides. But just remember to ask questions or to explore the subjective information. Okay? Okay. So, one of the most common complaint or concerning symptoms of the head is the headache. We have different kinds of headache. We have what we call the tension headache, which is most common, but usually self-treated. You can just buy an over-the-counter medication or inuman mo lang ng biogesic or mag-rest ka lang, pwedeng mawala. And another type of headache is the migraine headache, which is most frequent. Okay? It lasts up to 3 days. Okay. So whatever the type of headache it is, so it is important to evaluate that headache or the cause of that headache, because it is important to rule out the life-threatening causes. Baka naman hindi lang ordinary headache yan. Baka meron ng life-threatening causes nga, like meningitis or inflammation of the meninges of the brain, subdural or intracranial hemorrhage, baka masyado nang mataas ang presyon, no? Blood pressure, okay, or magli-lead na to stroke, or there is a presence of tumor, okay. To continue with the headaches, there are also what we call primary and secondary headache. The primary headache, it has no identifiable underlying cause, and usually the pain is bilateral. It is steady, pressing or tightening. It is non-throbbing. It is mild to moderate intensity. So, the secondary headache arises from other conditions. Okay. So, some of these conditions may endanger the life of the patient. So, it is important to rule out other conditions first. You have to look for the red flags. Okay, so you have to ask the client, no, to describe the pain. You can use your old card in asking or evaluating the pain of your client. Ano ba yung red flag doon? Kung sinabi ni patient, this is the worst headache of my life. Yan, so ibig sabihin talagang matindi yung pain na yon. Probably, iba na yung cause nito. Okay? Okay, moving on. Ito yung mga red flag, no? The recent onset, bago lang, no? The acute onset like thunderclap, markedly elevated blood pressure. Pag-check mo, ang taas ang blood pressure. There is presence of rash or signs of infection. Naku, baka meningitis na. Presence of cancer, HIV, or pregnancy. Okay. There is a vomiting, and the type of vomiting is projectile vomiting. Or there is a recent head trauma. Those are example of red flags. Okay, for the migraine headaches, it is usually episodic, meaning it happens occasionally with irregular intervals. It tends to peak over several hours, and it is usually unilateral. Okay, it is a prodromal onset and or aura. Ibig sabihin, 1 to 2 days before the migraine, you might notice a subtle changes that warn of an upcoming migraine. Okay, this includes constipation or mood changes, from depression to euphoria, or food cravings, or neck stiffness, okay, nag-i-increase yung thirst or urination. So may mga nararamdaman ka prior to the attack of your migraine. So another type of headache is the tension headache. This is again episodic, okay, so meaning occasionally it happens with irregular intervals. Again, it tends to peak after several hours. It often arises in the temporal area. So you have to consider that the cause of the tension headache may be medication overuse also. Okay. So moving on to the health history of the head, you have to take note of the following, no? Kapag may headache, is it new, persisting, progressively severe headache? So that is red flag already. So you raise concerns of tumor, abscess, or mass. If it is sudden and severe, you have to consider subarachnoid hemorrhage. Could be related to head injury, meningitis, or stroke. Okay, if there is nausea and vomiting, and there is increased pain with coughing, sneezing, or changing in position, that could be a sign of a life-threatening problem of the head. Okay, so another type of headaches is the cluster headache. It is retroorbital, okay, so around your eyes. It is unilateral, okay. So to differentiate the type of headache, the primary headaches and the secondary headaches, you can refer it to your book, no? For primary headache, you read the table 10.1, and for the secondary headache, read table 10.2. Okay. The primary headaches includes the migraine, tension headache, and the cluster headaches. While the secondary headaches includes the causes, okay, includes headache from eye disorders like acute glaucoma, could be headache from sinusitis, meningitis, or subarachnoid hemorrhage, brain tumor, giant cell arteritis, post-concussion headache, and cranial neuralgias. Okay, those are secondary headaches. Okay, so to assess for the type of headache, to determine whether this is life-threatening, and to look for the red flag, you have to use your old card questions. For the onset, you can ask your patient the following questions. When did you notice the headache? For the location, where do you feel the headache? Can you point to the areas? Okay, the duration. How long has this been going on? Begin suddenly or gradually? Temporary or constant? How long does it last? Okay, 3 days, 7 days. What is the characteristic symptoms? What does it feel like? Can you describe the pain using the scale of 1 to 10? Okay. 1 as no pain, 10 as the worst pain you ever experienced in your life. Okay. Right. So to continue with our old card questions, for the associated manifestations, nasa A na po tayo, do you notice any other symptoms? What happened just before the headache? Any history of overuse of analgesics, ergotamine, or triptans? The relieving factors. What have you tried to make the headache go away? What has worked the best? Okay, for the treatment. Has anyone treated you for headaches over the past year? What type of headache was diagnosed? Okay. Have you used any medication? Alright, so those are the example questions. Okay, so moving forward to traumatic brain injury. Okay, baka ito yung cause ng headache. So, traumatic brain injury refers to the blow to the head or piercing head injury that interferes with brain function. Of course, not all injuries to the head can result in brain injury. So, depende naman yon, no? Kung talaga bang gaano ka lakas yung pagkabagsak, okay? Maybe mild to severe, maybe time lapse between injury and manifestation symptoms. Okay. These are the sample questions, okay, old card questions to determine if there is really a traumatic brain injury. So the onset, when did this occur? Do you remember how you hurt your head? For location, can you show me where it hurts? For the duration, did you lose consciousness? For how long? For the characteristics, did you experience symptoms prior to the head injury? Okay, baka naman nahihilo pala siya, tumataas na yung blood pressure. Kaya yun, bumagsak at tumama yung kanyang head. Yeah. Okay, for the associated manifestations, you can ask the patient, do you experience vision changes, nausea or vomiting? Attention span deficits, yan, parang nawawala na yung focus. Dizziness, confusion, drainage from the ears, the nose, the eyes or mouth. Do you experience tremors, seizures, or gait changes? Yan, medyo nahirapan na bang naglakad. Relieving factors or strategies. Okay, what did you do to prevent the further injury? Okay, so this ends the first part of our physical examination on the head and the neck. So the second part of this video is the physical examination of the neck na lang. Okay, so before ending this video, let me read to you these quotes. The nurse, just another word to describe a person strong enough to tolerate everything and soft enough to understand everyone. So may you have a good heart. Okay, future nurses. Okay. So this is the reference or the references of this presentation. Thank you everyone for your time. God bless you. God bless us all.